This is a video by Stork Bullock Family Mortuary explaining what to do after your loved one has passed. The attending nurse will call your funeral home provider that you have chosen at the beginning of comfort care. They will then come and bring your loved one into care, whether it's at a facility or residence 24 hours a day, 7 days a week. The family is contacted, usually the next day, by a mortician of the mortuary to coordinate a time to make funeral arrangements. In the unfortunate event your loved one passes unattended and is found, your first step is going to be to call the non-emergency line of your local police department. They will decide which appropriate departments are needed to respond, for example, a police officer, coroner's office, or similar official. After the process is completed, they will inform the family how that responding department will proceed. Either they will call the funeral home or take the individual for further investigation at their facility. The mortuary will come to the designated place and bring your loved one into care 24 hours a day, 7 days a week. The family will be contacted, usually the next day, by a funeral director of the mortuary to coordinate a time to make funeral arrangements. If your loved one is taken for further inquiry, the attending official will explain what happens next regarding what they are needing to do to complete their investigation. If you have not chosen a funeral home, this will be the time to start looking into which one best suits your family's needs. Once it is chosen, you will need to sit with your funeral director to make the final arrangements. During this meeting, the paperwork needed to release your loved one into the funeral home care will be completed, so it may be sent over to the coroner's office. Once received and filed, the coroner's office will inform the mortuary when they are able to come over and make the transfer of care. When a family member passes in either a hospital or hospice facility, the supervising nurse will ask who your funeral home choice is. If you have not selected one at this time, you will need to call and find out which one can accommodate and fulfill your family's needs. When the establishment has been given, the facility will call and give the information needed to coordinate and complete the transfer of care 24 hours a day, 7 days a week. The family is contacted, usually the next day, by a mortician to meet and make arrangements. The attending nurse will call your funeral home provider that you have chosen at the time of intake. They will come and bring your loved one into care 24 hours a day, 7 days a week. The family is contacted, usually the next day, by a mortician of the mortuary to coordinate a time to make funeral arrangements. This can feel like an overwhelming process, but the right funeral home will always make sure you are comfortable and confident in the choices you make. When reaching out for information or pricing and you feel as if you are not satisfied completely by your first initial contact, please continue to call around. You have options, especially in death care. From our family to yours, we are here when you need us most.